I'm Dr. Sedicott, a pulmonary and critical care fellow at Mount Sinai Medical Center. This instructional video will review the indications, contraindications, techniques, and potential complications for the insertion of peripheral intravenous catheters. Peripheral intravenous catheterization is a common procedure required in a variety of clinical situations, including the administration of intravenous fluids, medications, and blood products, as well as other situations where access to the bloodstream is required. Relative contraindications to the placement of a catheter in a specific site includes local infection, phlebitis, sclerosed veins, burns, and traumatic injury. Prior attempts at catheterization and/or intravenous infiltration at a particular site are also relative contraindications. Other relative contraindications to the placement of a catheter in a specific site include the presence of an arteriovenous fistula or certain postoperative situations that can compromise venous return in an extremity, such as following mastectomy. Of the required equipment, choose an appropriate catheter size. Peripheral catheters generally come in two types depending on your institution: straight and winged. Peripheral catheters come in a variety of gauge sizes and lengths, with the choice of catheter depending on the indication. Conditions which require rapid resuscitation, such as hemorrhage or trauma, require short, large-bore catheters of either 14, 16, or 18 gauge. Administration of fluids, medications, and antibiotics can typically be accomplished with smaller catheters of 20, 22, or 24 gauge. Smaller catheters are less likely to cause mechanical phlebitis and less likely to obstruct blood flow within the vein, but do not allow for more rapid infusions. Other equipment needed for the procedure are non-sterile gloves, eye protection, non-latex tourniquet, 2% chlorhexidine-based antiseptic solution, sterile 2x2 gauze, saline flush, transparent occlusive dressing, tape, extension tubing, and a sharps container. In preparing for IV insertion, first discuss the procedure with the patient, and then discuss potential complications and answer any of their questions. The choice of site depends on multiple factors, including accessibility and visibility of peripheral veins, the age of the patient and their personal preference on where they are comfortable with having an IV, and the urgency of the situation and the size of catheter required. Veins located in the upper extremities are preferable to veins in the lower extremities due to increased rates of infection and thrombosis with IVs in the lower extremities. It is preferable to avoid veins over joints, for example, the antecubital fossa or the wrist, as movement can result in a mechanical phlebitis or kinking of the cannula, and there is a risk of cannulating an artery. In more urgent situations, the median cubital vein in the antecubital fossa is typically a large vein that can be cannulated easily. Place the patient in a supine position with the extremity for IV placement being evaluated and supported. Make sure that you have adequate lighting. Maintain proper hand hygiene prior to putting on gloves and eye protection. Tie a tourniquet approximately 6 to 10 inches above the likely puncture site. Inspect the extremity for a vein suitable for cannulation. To palpate a vein, apply gentle pressure and then release. This will allow you to feel the vein as it refills. Techniques to make veins more visible include asking the patient to open and close their fist repeatedly or applying warm compresses to a site. Once you have identified a suitable vein, clean the area thoroughly with 2% chlorhexidine solution, being careful not to touch the area once cleaned. Allow the skin to dry completely before proceeding. Prior to using the chosen catheter, inspect it to ensure there is no damage to it. Turn the plastic catheter over the needle to ensure that it is easily mobile. While holding the catheter in your dominant hand, use your non-dominant hand to apply traction to the skin distal to your intended puncture site. Next, insert the catheter into the skin, bevel side up, at a 10 to 30 degree angle, depending on how deep the vein is below the skin. As the catheter and needle enter the vein, you should see a flash of blood into the chamber behind the catheter. Be careful not to advance the needle and catheter too far to avoid having the needle puncture both walls of the vein. Once you see the flash of blood going into the chamber, lower the angle of the needle so that it is nearly parallel with the skin. While holding onto the needle with your dominant hand, use your non-dominant hand to advance the catheter into the vein. Before retracting the needle, undo the tourniquet to avoid excessive blood loss and place the 2x2 gauze underneath the catheter hub. Retract the needle, attach your extension tubing, and flush the catheter with normal saline. Ensure that there is no swelling or discomfort at the insertion site. Secure the catheter to the skin with tape and loop the tubing to help prevent accidental removal of the catheter. Place the transparent occlusive dressing over the catheter, making sure that the insertion site is clearly visible through the transparent dressing in order to help ensure easy assessment of the site. Some common complications with IV catheter insertion are pain or discomfort, bleeding or bruising, and infection. Most institutions recommend changing peripheral catheters every 3 to 4 days to attempt to reduce the risk of infection and phlebitis. Other complications include peripheral vein infusion thrombophlebitis, which is characterized by pain, erythema, swelling, and palpable thrombosis of the cannulated vein. Thrombosis, embolism, and nerve damage are potentially more serious complications. Proper maintenance of the catheter by IV fluids or saline flushes can help reduce the risk of thrombosis and embolism. Insertion of a peripheral IV catheter is an extremely common procedure which is often essential to the care of patients in the inpatient setting. It is imperative that the practitioner has a clear understanding of the clinical indications for the procedure to ensure that the correct size and location for the catheter is chosen. The proper insertion and maintenance of these peripheral IV catheters is essential at minimizing complications during and following the procedure. Thank you for watching this Harrison's procedure video.